1700s, a period of industrialization, revolution, and growth of cities. The 1700s in Europe and in the United States were marked by industrialization and movement into cities. The people benefited by this change into an industrial economy. The people who moved to the cities used coal to heat their homes, and they had better food and clothing. Despite these benefits, many people suffered from the industrialization. The rise in population made it difficult for people to find adequate housing, schools, or police protection. The overcrowded cities were filthy with garbage and poor sanitation. Plagues and illnesses spread throughout the city inhabitants. In Europe, the majority of people believed that the epidemics and illnesses were caused by contagion that grew from the putrefaction of waste. America in the 1700s. The health conditions in the 1700s were appalling. Diseases like cholera, smallpox, and diphtheria were pervasive. The southern states experienced an increase in diseases such as yaws, yellow fever, and malaria, all due to the slave trade. In 1701, Massachusetts passed laws permitting patients with smallpox to be quarantined. Under these laws, ships would be quarantined as needed. The laws were put in place in an attempt to control disease and protect citizens. In 1736, in New York City, the City Almshouse, located on Broadway near Park Row, opens an infirmary with 6 beds. This infirmary grows into Bellevue's hospital. In 1751, Benjamin Franklin and Dr. Thomas Bond receive a charter from the Pennsylvania legislature to open the first hospital in the American colonies for the sick, poor, and the insane. In 1789, the first life expectancy tables were made by Dr. Edward Wigglesworth. These tables provide insight into the health conditions of the time. Our current projected life expectancy for 2020 is 79.5 years, and in the 1700s, the average life expectancy at birth was 28.15 years. In 1795, Thomas Paine published his pamphlet Agrarian Justice, in which he proposed a social welfare insurance program for the nations of Europe and potentially for the young American Republic. In 1796, the Boston Dispensary, the first organized medical care service in New England, is founded. This organization is the recognized forerunner of the present-day home care programs. In 1798, the Marine Hospital Service is established by an act of Congress to provide for the temporary relief and maintenance of sick and disabled seamen. This was the first prepaid medical care program in the United States. It was financed through compulsory employer tax and federally administered. This service later became the Public Health and Marine Hospital Service, which is the predecessor to the U.S. Public Health Service of today. The 17 to 1800s. The United States was experiencing strong industrial growth. Long work hours and unsanitary conditions resulted in massive disease outbreaks. U.S. public health practices targeted reducing epidemics or large patterns of disease in the impacted populations. Some of the first public health departments were established in urban areas as a result of these epidemics. The goal of our profession in health education and promotion is to improve the quality of life of our target population. We believe quality of life is directly related to health status. The 1700s was a decade of health challenges that were met with social change. Our profession benefited by improvements that were made in medical care and medical services. The focus of this period was to control and treat disease in the individual and at the community level. This was accomplished through the construction of hospitals, medical schools, legislation, and public health programs.